Here's to another story now. Several provinces are battling to operate the full fleets of ambulances. Health Minister Dr. Joe Phaahla says some are only performing at half capacity. This is due to a shortage of paramedics and means the country has less than half of what it needs for residents. The department's spokesperson, Foster Mohale, joins us now to give us more details about this. Foster, thank you very much for your time. This is quite concerning that provinces are saying that they're only running ambulances at 49% because they don't have capacity in terms of personnel. And there's been a lot of complaints by civil society about the fact that there are posts in the health department that haven't been filled.
Good morning, Maseho, and good morning to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, as Minister of Health, Dr. Joe Phaahla has indicated through the parliamentary response, we do have a shortage of ambulances in some provinces. But what we are doing is that we deploy the little ambulances that we have, mostly in densely populated areas like your villages, your rural areas, your informal settlements and townships, precisely because most people who are staying in suburban areas like yourself are medically insured, meaning that you have got an option of calling a private ambulance, but also you have got you are staying more closer to a number of facilities, both private and public facilities. So we prioritize the underserved areas.
The minister also said that 967 ambulances were out of commission because of accidents or routine maintenance not being done.
Yeah, not necessarily because the maintenance was not done. But if you can remember how the ambulances are being used, different from our private vehicles, the speed at which they travel, but also some of them, they happen to, while they are rushing to rescue those who are involved in accidents, they happen to also to get involved in accidents, they hit the pothole. So that's why we frequently maintain them, as unlike our cars that we only take to for service at least once per year or after 10,000 kilometers. So they reach a higher mileage within a short space of time, so that we don't want to find ourselves one day where we find an ambulance which is stuck with the patient inside. So that's why we ensure that all our ambulances, they are taken to repair on a frequent basis, but also those who are involved in an accident as well. It's another challenge, but we understand that the speed at which they travel in order to save the lives of our people.
When will certain positions within the health department across provinces as well be filled? Because, for instance, the Western Cape Health Department says it's got, 258 licensed ambulances, but not enough, personnel to run the ambulances. So they only use 120 of the 258. So for them, for instance, the issue is that they do have ambulances, not enough, yes, but instead of all 258 of them being able to work, only 120 do because they don't have the paramedics to drive.
Yeah, but also it's a combination of many factors. Of course, the issue of a shortage of staff, but also some of them you may find that they are going through other challenges like your disciplinary hearings and all those things. So this is another cause of a shortage of staff. But we work closely with the provinces to ensure that they prioritize filling these vacant and funded positions, to ensure that we don't strain the little staff that we have currently in our employment.
But you haven't answered my question in terms of filling posts. This has been a problem for quite a couple of years.
Yeah, no, definitely we agree that. Hence I said we are saying that we constantly communicate with the provincial counterparts to ensure that they need to prioritize all the critical positions like your doctors, the nurses, including the paramedics, because they play a key role in our public health system in order to save the lives of our people. So we constantly communicate with the provinces and assure us that despite the challenges that they are going through, they will ensure that majority of positions that are funded, they are going to be advertised.
And you have to understand why the NHI looks good on paper, but why a lot of people are thinking South Africa isn't ready to implement the NHI because of such issues.
No, not really. I think you are clouding issues here, though. This has nothing to do with the NHI, but also in terms, if you have to touch on NHI, remember that you also outsource the services from the private sector, like your other specialists, also including the ambulance services, because we believe that we cannot allow a situation where people are involved in accident, they cannot be saved precisely because they are not medically insured. So we work closely with the private medical agencies to ensure that they assist us. So this is how we're going to work with also when we implement the NHI to ensure that people are not going to be just based on their socio-economic status, but we are all equal in order to access the quality and affordable health services. So we work closely with our private emergency services.
And I agree that the quality is also what's important, to be able to make sure that even when we do access health services through the NHI, that there's quality, enough staff and enough resources to be able to make sure that people actually get that quality healthcare that is promised in the National Health Insurance. But I just want to know something, Foster. It says in the report, or investigations by other media show that the Northwest is the most badly affected when it comes to the fact that they don't have enough ambulances, etc. Is there any particular reason why that province? I mean, this reminds me, of course, of the Northwest government bringing in those donkey carts to try and get people to hospitals because they're trying to make a plan. They're scrambling in terms of being able to get people to different hospitals. So why is this province in particular, receiving the bad part of this whole situation?
In fact, it's not, but also the issue of population size also is an important fact. But we've been communicating with our colleagues in the provinces, including the Northwest province, just to understand what is the state of ambulance services, especially those who are involved in services. I mean, involved in accidents, and how long is it going to take for them in order to make sure that they are back on the road. But also those who have been taken to for maintenance to ensure that they don't stay longer. But the other things that when we have got all the ambulances, the number that you see is not the total number of ambulances. We've got what we call the buffer stock of ambulances, so that once an ambulance is involved in an accident, we are going to immediately replace those ambulances. So we've got ambulances which are staying in order to replace those which are involved in accidents, also those who are taken for repair. So the number that you see for Northwest is not the total number of ambulances they have in the province.
Now, the DA MP, Hasina Ismail, who posed this question to the minister in Parliament, says that she also believes that, the shortfall is because of a shortage of staff, but she also makes mention of budget, bureaucracy and red tape around budget and how different departments can use those budgets. Is there any solution to this particular issue? I mean, we've seen it even, for example, just an example with Eskom, where there'd be bureaucracy and red tape that would stop them from getting things that are needed to make sure that we have, a better megawatts in terms of the grid, etc. So, is it true what she is assuming, that there's also those budgetary, not necessarily budgetary constraints in all the provinces? Sometimes there is money, or it's reallocated around other projects, but there's bureaucracy and red tape in terms of how they can use the money that they still have.
Maybe I don't know where she got that information, but when coming to life-saving equipment, we don't compromise. So the issue of bureaucracy, it doesn't apply. Minister will tell you, the MECs will tell you that they cannot delay any process to procure the life-saving or support machines in order to ensure that we don't lose the lives of anyone precisely because of internal bureaucracy. So when coming to this infrastructure or equipment, we don't waste any time. So the minister or the MECs, the HOD, they will know that when coming to this one, they get audited. We meet with them on a monthly basis. These are some of the issues that we discuss. The issue of filling the essential or critical posts is one of the issues that always dominate our meetings between the minister and the MECs in the provinces.
Foster, I'm going to try and just squeeze in this question very quickly. It has nothing to do with what we've been discussing. We're going to be speaking to SAPRA on the show a little later on, I think around 1 o'clock, about this injection that they've approved in terms of PrEP and preventing yourself from contracting HIV/AIDS, right? But there are a lot of complaints about how expensive this injection will be. This also the expense of medication also sparked those protests that we saw those years ago in terms of ARVs and how people need this type of medication. We'll be speaking to them a little later, but as the department, what are your thoughts about the expense of medicine that, as South Africa, as a country that has one of the highest statistics of HIV and AIDS, maybe they should lower how much this injection costs?
No, definitely, as the department also, we are equally concerned about the price of medication. So we are going to engage all the manufacturers of all the similar, like we've done before, where we managed to convince all these manufacturers that they must not put the profits first, but they must know that their roles also, they must play a key role in saving the lives of our people, or also the infection of or transmission of HIV. So we are going to engage this manufacturer just like we've done before. We managed to convince other manufacturers of different medical products. They managed to reduce the price of the products because they know that even if they are going to reduce the price, they're still going to make the profit. But what should be prioritized is saving the lives of our people.
All right. Thank you very much for speaking to us. That is the Health Department's spokesperson, Foster Mohale.